Good afternoon panel, but also good afternoon to members of the public. Welcome to the Sheffield COVID-19 Prevention and Management Board public session. It's our first session, which gives you, the public, the opportunity to raise questions regarding the impact of COVID-19 on our city, our city, individuals and communities, and especially the manner in which everyone has been involved in responding to this pandemic. We have seen some of the most extraordinary actions, support and kindness, but also understandably there have been and are some very serious concerns and fear about the virus and its impact. We probably will not be able to answer all the questions and all the concerns you may raise, as the impact, sometimes positive, quite often negative, has also been and probably mainly dependent upon government decisions and actions that we've had to follow. But we will do our very best to respond to you and our citizens. Right, Greg Fell, our Director of Public Health, who many of you may know, and many will have heard of, especially throughout the pandemic. He's been a star, he's been on radio, he's been on national TV, and it's been constantly responding to hundreds and hundreds of emails and correspondence. Greg will introduce some of the data, the information and the Sheffield position, and the response in, around and from Sheffield. During this briefing, it will also explain the establishment of this board. We will then take questions, and I will invite those of you who have expressed your interest and registered to raise a question to do so. It appears that there are around 60 people registered, so we won't be able to get round to everyone. In fact, probably only anything between half a dozen and a dozen. But we would ask you, there is a function, a question function on your screen. If you wish to submit a question there, if you're not called in, we will record it and we will get back to you with an answer to your question. There is also an email address that you can email questions to, which is COVID-19 publicquestions@sheffield.gov.uk. So if you wish to submit a question you don't have chance today, please do that. We've only got 1 hour today because there are some unmissable appointments that people have after 2 o'clock. But at the next meeting, we're going to commit to 2 hours for the next session, and we'll be holding these a minimum of once a month. And if we feel it necessary, we'll include some more into that, dependent upon the interest and the circumstances. So before Greg starts his briefing, I'm just going to ask the board, the COVID-19 Prevention and Management Board, just to introduce themselves. I'm Councillor Julie Daw, leader of the council and chair of the board. So I will, Jackie, if you would like to introduce yourself first, and then we'll go around the screen.
Good afternoon, everybody. My name's Councillor Jackie Drayton. I'm the councillor for the Burngrave ward, which is where I live, and I'm the cabinet member for children, young people and families, and have responsibility for public health as well. Thank you. Good to be here.
Douglas?
Yes, I'm Douglas Johnson. I'm a councillor for City Ward, and I'm part of the Green Party.
And Shafak? All the councillors first.
Yeah. My name's Shafak Mohammed. I'm a councillor for Ecclesall Ward, leader of the Liberal Democrats and leader of the opposition Sheffield Council. Thank you.
And then we have Val.
Hello, I'm Val Bowen. I'm the Information Officer at Disability Sheffield, and I'm standing in for Emily Morton, who is our CEO, who's on holiday today.
Thank you. Joe?
Hi, I'm Joe Rennie. I'm the Group Director for Student and Academic Services at Sheffield Hallam University, and I'm a member of the Gold Incident Management team that is leading our pandemic response.
Thank you. Pauline?
Hello, my name's Pauline Kimantis. I'm Chief Executive of Sheffield Carers Centre, which is a local charity that supports the unpaid carers in Sheffield.
Patrick?
Good afternoon. My name is Patrick Malidi and I work at Pittsmore Adventure Playground and support Sharrow Community Forum. Got a long history of working in Sheffield over the last 25 years, and I'm here because I want to make a difference and make sure that things are running in an appropriate manner. Thank you.
Thank you, Patrick. Gulnaz.
Hello, good afternoon. I'm Gulnaz Hussain. I'm part of a BEMA organisation based in Sheffield Grassroots in Burngreave, and I'm also part of the BEMA strategy group for COVID-19. Thank you.
Thank you, Gulnaz. Alexis.
Good afternoon. My name is Alexis Karachi. I'm a director, one of the directors at Sheffield Chamber of Commerce. I'm also currently the co-chair of the COVID-19 Business Response Group, which is looking at the economic recovery plan for the city.
Steve.
Hi, I'm Steve Chew. I'm Chief Executive of Age UK Sheffield, the older people's charity, providing an older age perspective on this board.
Dan, would you like to just say who you are?
I'm Dan Spicer. I'm a policy officer in the strategy and partnerships team at the council. I'm working to support this board and its work.
Andrew.
I'm Andrew Jones. I'm the Director of Education and Skills in Sheffield City Council. I'm not a member of the board, and I'm here today to support the board in answering any questions on schools.
Yeah, I'm sure there's a lot of interest on that at the moment. Ruth.
Hello, I'm Ruth Granger. I'm in the public health team in Sheffield City Council, so I'm here with Greg to help answer questions.
Okay, and then finally we have Greg, and so when Greg introduces himself, if you go into your presentation, Greg, please. Thank you.
Thanks, Julie. So I'm Greg Fell. I'm Director of Public Health for Sheffield, and I shall kick off with a fairly short presentation on where the city is, what the current arrangements are, and some thoughts for the future. I'm going to try and share my screen if Dan hasn't. No, I've been disabled from sharing my screen. Dan, could you share my slides?
You should be able to share now, Greg.
Okay. Oh, I can. Right. Okay. There you go. Share. Right. Can you see my slides? So I will talk. All right. Here we are. So the three things in about 5 to 10 minutes. I'm not going to bore you all intensely with loads and loads of data and numbers. I can if you want, but it's probably the story. So I'll talk a little bit about the epidemiology. I'll talk a little bit about our arrangements to manage and the current hot issues. And I'll end with what the core messages, which to cut to the chase, are relatively unchanging. So those of you that want me to say exciting things about the core messages, then you can dial off now, because I'm going to say the same things that I've said before. This is the picture from last week's national surveillance report. Sheffield is there. A few things that's worth saying about what's happening nationally. It's pretty clear that the transmission of COVID-19 is beginning to rise again. We had been at the bottom end of wave 1 of the pandemic. It's been pretty clear for the last few weeks now. If you look at the Office of National Statistics surveillance, which they publish weekly, it's pretty clear that the prevalence is beginning to rise again, up and down the country. This graph is a week old. I've not yet seen this week's publication. I'm anticipating that this week's publication will be rather more yellow and orange with a little bit more red than last week, and our expectation is that will continue for reasons that I'll come on to. Sheffield is here in the middle. It's been well-trod territory that the rates in South Yorkshire, with the exception of Doncaster is interesting, are higher than they need to be. They have been coming down and they're at a relatively low rate, but they're still higher than they probably ought to be. And I'm certainly not in a position of any comfort at the moment. We've pushed pretty hard on testing, finding, isolating, and doing the right thing, particularly in some parts of the community over the last month and a half now, and that has worked. And you'll see in a minute when I get to the rates in particular that the numbers have come down. But we expect they will start to go up. So Sheffield, you can see kind of Sheffield and South Yorkshire is in broadly the same position. You can see what's going on in Greater Manchester. Leicester is still red. Leicester is the red dot right in the middle of the country, and this is the West Midlands, which I think Birmingham is currently in or somewhere close to lockdown. We're at the end of wave one, and we're likely to see more cases through the winter. So this is what's happening in northeastern Yorkshire over the course of the pandemic. The South Yorkshire is the grey line here. You can see there was in mid-March onwards, there was exponential growth. There's been followed by a reasonably slow fall. Sheffield is now here. We had a hump of cases in South Yorkshire in early to mid-July. That's now coming down. The numbers in Sheffield and numbers in South Yorkshire are beginning to come down. West Yorkshire is the yellow line. West Yorkshire has a much higher rate at the moment than South Yorkshire. So in national terms, is far more on the worry list than South Yorkshire. But the but is I'm expecting rates will start to go up in that type of way. What we're hoping to avoid is them going up in that type of way, which is the exponential growth. So Sheffield. This is Sheffield data. This is live data up to date as of earlier this week. It changes from day to day. We update it every day. So current 7-day rolling incidence is the most important measure in terms of the what the current infection rate is. We tend not to do one day incidences because it's a really low number of infections, and day to day it spikes up and down. So we tend to look at 7 days because it averages out the fluctuations. So 10.7 per 100,000 for the demographers amongst you. There's 575,000 people live in Sheffield, so you can do the math relatively easily. There's in the order of 10 or so cases diagnosed per day in that order. It's the lowest since early March, and it's fluctuating. You can see the fluctuations over the course of the last few months as generally fluctuating downwards. Currently, 1.8% of people that think they have this illness, so that have symptoms, test positive. So 98% of people who think they have this illness don't have this illness when they get a test. That's an important message. The vast majority of people don't have this illness, but 1.8% do. Hospital activity is negligible. There are still some people in hospital. There are very, very, very few new admissions to hospital. A handful once every couple of weeks, and there are again deaths are negligible now. So obviously that's good news for all sorts of reasons. So if I had to summarise the epidemiology now, it would be in these 4 or 5 bullet points. Overall numbers are lowest since March. Good news, obviously. The spatial spread is different. If you'd asked me the question about a month and a half ago, there was a fairly high degree of concentration in some wards in the east of the city. That's not the case now. We've aggressively intervened, and the evidence is that intervention was largely successful. We've got a much wider spread, admittedly with very, very small numbers, but it's diffuse. Tends to be household clusters, and it does remain more associated with more deprived areas, but not exclusively so. The mean age of a typical case, a typical person with this illness, is much lower. March, April, it was in the 60s. Now it's in the early to mid 30s, and that's probably to do with significantly reduced exposure in older people. Many older people also have concurrent illnesses and have been shielding. And actually, we're pushing testing really hard. And the people that are coming forward for testing are thankfully those who have relatively mild symptoms, and we're testing them and they're isolating and their contacts are isolating. And that's an important point. Most young people who test positive will have really mild symptoms. I'm not terribly worried about that, but what I am worried about is transmission to people who have the potential for much more serious illness. That's the bit that worries us all, certainly as we go into autumn. Ethnicity has shifted. A month ago, the majority of people who tested positive were British Pakistani or South Asian. That shifted. It's still disproportionately affecting Burma communities, no doubts there, but there's a much higher percentage of white British people testing positive. So the ethnicity has shifted along the way, and I would expect that to continue to fluctuate. So and we will continue to shift our strategy as we continue to fluctuate. I think I've said most of what I need to say already in that slide already, so I'll skip over that. The strategy is really simple. The council cabinet, led by Julie, have set out a really simple strategy. It's fourfold: keep people safe, protect the vulnerable, reopen Sheffield, follow government advice. First two are fairly straightforward. Third one, we can't live in lockdown forever. So non-viable. So we have to reopen Sheffield. It's really important economically and socially and in all sorts of other ways. But we will do so safely. And the follow government guidance is last. We've taken a view that we will unswervingly follow government guidance. Occasionally we've disagreed with it, but we followed it all the same. Occasionally we've disagreed with it and gone on a slightly different path, very, very, very fleetingly. There's a reason for following government guidance, because it's the safest place to be. Because if 150 odd local authorities all make up their own approach, then that's a much messier position to be. So we have followed government guidance. It's occasionally been uncomfortable for us, but by and large we've done that. And then, as is always the case, the strategy is fairly straightforward, but there's a long operational plan. The link to it is at the bottom of the page there. Based on the premise of prevention is always, in every walk of life, more important than managing things once they've happened. How knowing and then being able to respond. So we have stood up and will continue to have stood up for some considerable time, a fairly robust response to outbreaks when they happen. There will be flare-ups over the next couple of years, I suspect. That's unstoppable. The important thing is that we can pick them up quickly and we can respond quickly. We have both soft and hard intelligence. We've got fairly detailed epidemiological information that's really helpful. As is always the case, most of the really important stuff comes into mine or Ruth's or one of my team's inbox in all sorts of different ways, just as soft intelligence. And we often find out about things a long time before they get turned into data. Both of those are really important, and we've got reasonably good feeds for both. Contact tracing is obviously quite a hot topic at the moment. There is a national test and trace service. It is operating in Sheffield. It's doing okay. It could do better. And localization of contact tracing is one of the next big things. Support for those who are self-isolating. We've provided a range of support as a city to those who are self-isolating. Both the voluntary and community sector have done amazing things, but also the council have done some good work to support those. Financial support to those who are self-isolating is a hot issue, and I should come back to that, I think, in questions, because I've seen one at least. Comms and engagement work, our comms team, or our comms team in the council, but also all of the comms teams in agencies across the city have done an amazing job. And how long will that remain? And I've seen there's a question on comms, so I'll pick that up as we go. Our plan sets out some specifics about what we do in certain settings: care homes, schools, workplaces, and others, and high-risk places, high-risk communities, and high-risk populations. Local testing capacity. Many of you will have noticed that we've put a huge amount of effort into increasing the local capacity to do testing. There is a drive-through centre for testing at Meadowhall that many people know about. There's also a testing unit at the Olympic Legacy Park. There's one in Sharrow, there's one in Darnell, which will hopefully be online on Monday, very, very near future. And we'll continue to increase local testing capacity. Contact tracing, so important, I've mentioned it twice. Vulnerable people is basically the shielding programme. Shielding has been suspended by government. I think there still will be a need for support to people who are choosing to shield, and then the establishment of a local board, the COVID-19 Prevention and Management Board, which is the group of faces you can see in front of you. Nearly done.
Greg, sorry to interrupt. I'm just going to take bring one of the questioners in at the moment, because it's quite relevant. It's from, I do apologise if I pronounce your name wrong or incorrectly. It's Fides or Fides Matstuff, who is asking if you could maximise your screen and press F5. But The other thing I was also going to say at this point, that's it. But
I'll go on a call, Julie.
But we'll put this presentation, we'll make it available on the website.
Yeah. My worry list. This is not all over. We're all expecting cases will rise in the autumn. All of the epidemiology tells us that very, very clearly. Nationally, locally at the moment, we're in a reasonably good position. I'm not comfortable, but we're in a reasonably good position. But cases will rise in autumn for a whole bunch of reasons. But partly coronaviruses tend to be seasonal. Partly we're all outside. Well, I'm not outside today, but we're mostly outside at the moment. We'll all be back inside in the not too distant future. Coronavirus tends to like cramped, poorly ventilated enclosed spaces. Schools will be going back, universities will be going back, and there's a range of reasons that will lead to cases going up. So anyone who has the impression this is all over is mistaken. This will be going on for at least until we have a good vaccine, which if I had to guess, I would say early to middle of next year at the earliest, and probably beyond that. So we will be standing up a response for at least 18 months, but we have to also get back into the business of business as usual. So our acute response will be basically to avoid an imposed local lockdown. You've seen what happened in firstly Leicester, then Blackburn with Darwin, and Pendle, now Birmingham. That doesn't help anybody, and we don't want, nobody in Sheffield wants that. So we are very, very, very focused on avoiding that. Improving contact tracing, as I say, it's working, it's okay, it could be a lot better. We stand ready to work with governments to localise a significant chunk of the contact tracing, because the failings of the national contact tracing is it's run from a call centre 250 miles away. We need to get our boots on the ground in some of the communities that we basically find hard to reach. So we stand ready for that, but we do need government to resource that for us. Schools and universities are going back soon. Both schools and universities have done a huge amount of prep, and credit to them for doing it. But it will lead to significant influx of people, students to Sheffield, and it will lead to more mixing. So it is on our worry list, but it's still the right thing to do to get schools back and to get universities back. Intervention fatigue, we're all sick of it, but we're going to have to stick with the programme for some time to come. Getting people tested and follow up on isolation of contacts, which I've talked about enough. Financial support to those who are isolating where needed. You will have seen Matt Hancock's announcement yesterday of a payment of £13 for those who are being asked to self-isolate. I think that's based on the national minimum wage. If you have a family of 4 to feed, £13 a day is not that much. So a personal view, I don't think that's enough. It is the national offer at the moment. It's being tested, and I think the feedback from those places it's being tested will be fairly strong. Hoaxes, there's a lot of them about. COVID is all a hoax or a conspiracy theory. No, it's definitely not true. There's a hoax that's doing the rounds at the moment on social media. We'll forcibly test and detain your children if they test positive. That's categorically not true. The schools are not able to do that. We would never do that. Where people get their information from is proving quite an interesting thing. And then last but probably most important on mine and lots of people's worry list is the medium and the long-term social and economic impact. Last slide from me. The core messages are constant, and I'm sorry. I drone on and on about this stuff. In order of impact, the things that make most difference are, if you have symptoms, stay at home. And we know that significant numbers of people who have really mild symptoms may not notice it, but if they do have symptoms, they should stay at home, because that's the thing that makes most difference. If you have symptoms, get a test and stay at home and isolate and give details of your contacts. Stay at home if you're identified as a contact. And again, that's about reducing viral transmission. Washing your hands, keeping your distance, both those two things matters. Wearing face coverings where recommended. A lot of airtime is given to face coverings. They do make a difference, but they don't make half as much difference as washing your hands and distance. And keep yourselves and others safe. So all of those things matter. And despite all of the very, very complex guidance that pertains to any particular eventuality, those are the things that are core within all of those. Those are the things that are going to make a difference to viral transmission. So to coin a phrase, we are all in this together. the board will be running for some time to come, those messages will be pertinent to everybody in every setting across the whole city for some time to come. So we will make those slides available, but I think I'll stop there and see where we want to go.
Right, thank you very much for that. I'm not sure how you remove your presentation from the screen now, Greg.
If I was vaguely competent, I might work out how to do it. Hold on.
I do say that I'll just about get used to all this new technology and new ways of communications, and then we'll be back to face-to-face. Very much hope so. Very much hope so. Right. Thanks very much for that, Greg. I'm going to bring in people to ask the question who submitted and registered and submitted their questions. So the first one I've got is Matt Steele. If Matt would like to enter. Matt, there you are.
Hello.
Hi, Matt. Would you like to ask your question?
My question was just, where is the best place to look to check the current state of infection in Sheffield, and what data are we actually looking for? Because I see lots of different data around. I think, Greg, you covered that earlier in one of your early slides. It's just, what is the key information to look for and where do I find it?
So I think that's one for me.
Yeah.
The best place is the Public Health England Weekly Epidemiology Survey. I shall post the link out, but it's the best place where all of the information is brought together for the whole country, but includes local authority level information once a week. And it does try to bring together all of the various disparate sources of information, which it's a bit complicated and it's a bit messy, to be honest. But the PHE weekly report is the best place that brings it all together and provides a bit of commentary on what the data is telling us, in terms of the specific metrics, the question you asked was positive test per 100 population versus incidence. The best metrics are the 7-day rolling incidence, so the number of people in a population who test positive per 100,000 population expressed over 7 days, and the test positivity rate of 100 tests. How many people, of 100 tests, how many people test positive? Both of those are equally important. And the third thing that's important is the rate of change. Is it going down or up? And if it's going up, how quickly is it going up? Because as we've seen to our cost, exponential growth that happened in early to mid March, that led us into the place that we were. So if the rate of incidence is going up rapidly, then we will find government breathing on us really very hard, very, very quickly, quite rightly and quite understandably. So I will find the link to the weekly Public Health England surveillance report and make sure it's posted in the chat, but we'll also put it on the website.
Okay, thank you.
Great, thank you. Steve Pagden. Steve? Steve, there you go. Hi, Steve, over to you. You are muted, Steve. Right. There you go.
Apologies for that. Yeah, thank you for a very informative presentation. Really enjoyed it. Good information. Can't disagree with anything. But given that numbers are currently low in Sheffield, I just wondered if it's time where actually the city could get behind something a bit aspirational, and we could actually advertise Sheffield as a zero COVID city, and wonder whether you've got any thoughts or any strategy in that direction, and why not? Why not do that now before we hit this winter spike? And actually, that's something the whole of the citizens should get behind.
Shall I start and make a political political response to that? One of the things we found, Steve, is getting that balance right between protecting every member of the public and ourselves, in fact, and our loved ones from the virus, but also the impact of the lockdown that the government imposed, which many people actually say was quite late in the day. In order to eradicate the virus, and Greg will say probably more about that, you would seriously have to lock down far more services provision, you know, organisations, businesses, etc., schools, in order to do that. But Greg may be able to express sort of the balance between, or the ability to be able to go COVID completely zero COVID free. But the issue we also have to consider is the impact it has on people with isolation, mental health, but also impact on their financial circumstances as well, without the ability to go to work, etc. Greg.
Thanks. So I would want a zero COVID goal. That's the elimination. I don't think it's attainable. I don't think it's achievable for a number of reasons. We can't seal the borders for Sheffield. One of the reasons why New Zealand is near COVID zero is they can't ever effectively seal the borders, and it's a relatively small country, miles and miles away from anywhere. Well, Sheffield's not like that, so we can't. I don't think we can do that. And to achieve zero COVID, we would need to be getting into the business of testing and retesting the whole population very, very frequently. And there isn't the lab capacity in the country to enable that. And I suspect it would be too difficult operationally to organise that. Ever, probably. It would need to be a nationally organised thing rather than a locally organised thing. I know we couldn't organise it locally. So whilst I think I want zero COVID, as do we all, I'm not sure it's attainable. What we are, and we certainly will continue to do, is where we identify cases, we will get on top of those cases. Hopefully people and their contacts will self-isolate, and sort of pushing testing, even if people have mild symptoms, as quickly and early as possible. That will keep the level of transmitting virus as low as humanly possible, but I don't think that will achieve zero. Much as I'd like it, wish it would.
Yeah, exactly. Thank you, Steve. Candice Majewski.
Hi there, thank you for the presentations. My question was actually about testing. And so I've seen lots of really good positive things about the drive-through testing facilities. But for those of us that don't have a car, what's your arrangements for that, or what would you suggest we do?
I've seen that Ruth's come off mute, and it might be more appropriate that Ruth answers this one, if that's okay.
Hello there, Candice. Yeah, there are a number of options for people who don't have cars. As you've correctly said, the Meadowhall site is drive-through, but there are appointments at the Olympic Legacy Park and at the site in Sharrow, and there will be appointments also at the site in Darnall, which is being set up next week, where people can walk through, so you don't have to have a car. Those sites, although it's a good idea to make an appointment because then you won't have to wait, they will take walk-ins as well. So if you go to Sharrow, if you go to Darnall site when it's set up, and if you go to the Olympic Legacy Park without an appointment, you might have to wait for some time, but you can be tested there. So that we're really keen to put that in place, because we know it's not straightforward for everybody to drive to Meadowhall. So we're really pleased we've been able to increase our testing offer there. So I hope that answers your question. Thank you.
Right, thank you. We also had the same question from Fides, and I'm going to bring Fides in because he does have another question and he can tell me how to pronounce your name. We have, there you go.
Sorry, I had to find all the buttons. My question was, my other question was, what is the current percentage of successful contacts traced in the current in the centre that we've got at the moment? You said it. Greg said it wasn't as high as we would like it. But so what? How high is it at the moment?
Yes,
74% of 74% of contacts are completed, and the technical definition of complete is found, identified, contacted, and given advice that they need to self-isolate as per the guidance. World Health Organization recommends it should be 80. I think it should be 90 to 95. The more the better. Currently, I think it's 73 or 74. That varies. So the tiers 2 and 3, which is the national call center stuff, is run by Serco and Sitel, is in the order of 51, 52, which is too low. The vast majority of contacts are passed on to Public Health England, the what's known as tier 1, and completion is 99 to 100% for tier 1. So all up, I think it's 73 or 74% of contacts are found, identified, and given advice, mostly within 24 hours, which is a fairly speedy turnaround, but it's not at the 80% which WHO and others recommend. So hence our efforts to localize it will be to get into the places that we find hard to reach, and we will need to put boots on the ground to do some of that stuff.
Okay, thank you.
It needs to be resourced, though.
That's encouraging. Thank you.
Yeah, good. Brett Hughes.
So Julie, I don't think Brett's here. I can't find his name in the attendance list. So
Okay, let's have a look. I've got a few around schools. So Tony Sanderson. We're having trouble, Dan, with
yes,
Tony.
Can you... I've got Tony's question.
Yeah,
so Tony might want to ask his own question, but I've got it in front of me.
I'm not sure.
Shall
I know it's something to do with schools because I'm trying to theme them. Would you?
The risk of doing Tony a disservice, I'll ask Tony's question, which was this, and it may be a question for Ruth and or Andrew. It's a school's question. For those parents who work in care homes or other areas considered vulnerable, will the school be highly responsive in reporting to parents any suspected or confirmed cases of COVID-19 in the school or the bubble the child belongs to, so the care home workers can be careful in order to limit exposure for vulnerable people that they care for?
Can I also bring Terry Connolly in as well, because I think Terry's got a school-related question as well, and then Andrew and Ruth can take them at the end if that's okay. Terry?
Terry's on the way in now, Julie.
Thank you. We'll keep Tony in. And Sarah as well.
Terry's in, Julie.
Shall I go to my question? It was just, I was interested to hear yesterday a report that children are exhibiting different symptoms to adults. So there were 5 symptoms that parents before term starts next week.
Terry, I think you froze for a moment, so we may have missed some of the question, but I do think you've posted it on the Q&A function, yeah?
Yes, I did.
Yeah, interested to see reports yesterday that children are showing different symptoms to adults. Is Sheffield planning to get this info out to schools and parents before schools return? And then if we can take Sarah Meza, and then we'll get Andrew and Greg and Ruth too.
Again, Julia, I can't find Sarah Metzer in the attendance list.
Okay then, so if we can answer Terry's and Tony's questions, please. Andrew.
I'll start Tony's question, but I'll just have to bring Ruth in as well, if that's okay. So there are obviously, I can understand the concern there that actually somebody working in a care setting might inadvertently come into contact with the infection in another setting through a relative, a child, for example. But obviously schools will be following protocols around information sharing and data sharing. And in fact, our experience shows throughout the pandemic, it's more likely that actually where schools, where anybody becomes infected who's connected to a school, that it's likely to be through a family or community transmission. And therefore it's the school who will be being informed that there's been an infection rather than the school actually doing that. But Ruth, just want to come in on some of the protocols around that.
Yeah, so our colleagues in our public health team who work with children have been providing lots of information to schools about how they handle situations in terms of positive cases of COVID-19. And just to highlight the point that Andrew made, actually the experience that they've had around the country of cases that they've had in people with either staff or children who go to school is that actually when they look back, they find that actually that the transmission of the disease happened in a community setting rather than in a school setting. So obviously that's a really interesting thing to bear in mind. But schools have got a number of processes to follow about when they have a case. And obviously people will have read about the bubble system, which is to make sure that you don't have to close the whole school, because it's not that everybody is mixed with everybody else. You've got quite careful arrangements about who mixes with who so that you don't have to shut the whole school, you just have to shut a class potentially if you have a case. I think the other thing for people to be aware of, and I know it's quite confusing, is about what a contact is. So when people are being asked to self-isolate, they're being asked to self-isolate because they've had direct contact with somebody who is positive. So for example, say that you have a child in a school who tests positive, the other children in that bubble or in that class will have to isolate, but not the family of those children, because actually the families of those children haven't actually had contact with that child who tested positive, if you see what I mean. So it's not about a contact of a contact having to self-isolate, it's only people who've had direct contact with somebody who's a positive case. So that minimises the impact on other people. I hope that helps to answer that question.
Okay, thanks. So Sarah did submit a question beforehand and says, as a person whose shield building, she is apprehensive about teenage children returning to school and asking similar questions about the risk and is there anything she can do to minimise this. So as I've said, hopefully we are answering the question satisfactorily, but if anyone wishes to follow up, please do so via the email address that I will announce again later, which is the public question email address. Okay. Right, I have Anthony Harrington. Anthony?
Can you hear me now?
Yes, yep. Anthony, fine. Off you go.
Hiya, I'm a committee member at the First Lord Tara, and I was wondering, Tara's pretty much the hub of local communities. When will Tara's be able to reopen and support tenants?
So I'll give a direct answer. The direct answer, Anthony, is I don't know. I'll commit to not getting just you an answer, but getting the answer out more broadly to the community. Oh, sorry. It's worth me saying that we closed lots of these services very quickly when we got to lockdown. Reopening them is proving somewhat troublesome. It's like a game of four-dimensional chess. Where the pieces keep moving around. We have a process whereby we're trying to reopen services as soon as humanly possible. And I don't know when Tara's will be reopened, but I'll commit to getting the answer out across Sheffield as soon as I can.
Thank you, appreciate that.
Yeah, I was about to say that it's easier closing something down than trying to reinstate it, and it's absolutely imperative that we get as many services reinstated as soon as possible, but has to be safe to do so. Thank you. Jared Adams. Jared.
Julie, I think I can't find Jared in the attendance list either. I'm sure he was here earlier, but he seems to have left the session.
Okay, Paul May. Paul? Technology.
Julie, I've got Paul's question in front of me. I've answered it by email. Oh, is he here? Right.
Oh, okay. Okay. Paul, I understand you've received a response, but would you like to ask a supplementary or follow up? Now you're here. You are mute, Paul, at the moment on your screen.
Okay. All right.
Yeah, there you go.
Right, thanks. It's a question about communication. So really I'm speaking on behalf of a number of residents in Ecclesall Forum and other local organisations as well. We would just like a bit more information really from the council generally about what's happening and what the details are. So I know that you currently use Newsroom and local media, although I noticed that this week's Sheffield Telegraph hasn't got anything at all about COVID in Sheffield, which kind of surprised me a bit. But anyway, the question is in a couple of parts. Could you use a much wider range of communications to residents And secondly, can the content of your comments be more detailed? Like, for example, risks of spikes and some of the details that you've talked about today, interestingly. That's my question. Thanks.
Can I just summarise that then? So in effect, it's about how we communicate and also what we communicate, Paul, because you've made a suggestion about, for example, some of the information that you have received today, if we can widely communicate that information, but also in the way that we communicate. Greg may wish to answer this because it probably could spend 10, 15, 20 minutes with a long list of the ways in which we've communicated since the start of it. I'm sorry the Telegraph haven't got anything in this week. There's constant press statements going out, information going out to the media on a daily basis. In fact, the local media have actually published a couple of circulars regarding schools and other things and around business, etc. and everything. But one of the roles of this board is to prevent and manage the pandemic and the impact of it in Sheffield. So one of the main roles of the board is to help communicate and get the messages out right across the city, but also particularly to targeted audiences when we know different audiences need different information at different times in different ways. So as you will see from the membership of the board, we've got a wide-ranging representation on the board where we aim to use that representation to get out all our information much wider. So we have a communications grid that the board received at the last meeting, and we populate that so that we find many different ways of getting out information rather than just from the council and through the media. So through the universities, through the Chamber of Commerce, through our local community groups, etc., and any other opportunities that any of the representative bodies that are represented can think of, and suggesting ways to get out that information, because it's absolutely imperative that we get information out at the right time to the right people in the right manner. So if you've got any suggestions, Paul, about how we can improve on that, if you forward that to us, then we'll consider it when we consider our communications plan that we do at every meeting, if that's okay. I don't know if Greg wishes to respond further.
Just briefly, so Paul, I did a detailed response. It's in your inbox somewhere. You may not have got to it, and again, I'll make that publicly available. We do social media, the normal print media, local radio, local TV, national TV. We've done mail drops, e-bulletins, worked with influencers, worked with local networks. We can always do better, and we're endeavouring to do better. But we're trying pretty hard on comms, actually, and to the credit of the comms team, for our comms team, but also all of our other partnered agencies' comms teams, they are constantly on this. So all and any specific suggestions we'll take with open arms, and any and all opportunities that we've got to get that message out to broader networks and broader communities that we're already reaching, then yes, we will definitely go there. No doubts about that.
Okay, I seem to be missing quite a lot. I mean, I'm an intelligent, informed kind of guy, and I don't see hardly any of this information. So I have suggested one or two other things, and I think I've sent the list in to you. I think Julie and Greg and one or two others. So yeah, I'll be interested to see how the communication gets to people, and if it's a bit more detailed than it is at the moment. For example, the stuff that comes out on the newsroom, interesting, but not very much detail in there. That's my view anyway. So thank you for listening to it, and I'll continue my discourse with people. Thanks.
Yeah, okay, Paul, we will absolutely take that on board. Just a couple of final comments from me would be that not everyone purchases the Telegraph, not everyone purchases the daily newspapers. Everyone accesses communications in many different ways. So therefore, we're having to try and reach everyone through all the means that we possibly can, especially through this board and the recommendations and suggestions that are made. But also we do all the things that Greg has sent out to you and in many other ways. So as I say, if you've got any further recommendations, if you wish to just post them forward. Right, Sean Duffy.
I think I'm live now, yeah?
Yeah.
Thank you. So just representing the views of Citizens Advice Sheffield, I'm employed with Citizens Advice Sheffield as an employment rights advisor. So we're helping many people in insecure, often low-paid employment, working 0-hours contracts or doing agency work, or frequently depending on overtime to make ends meet, and they're in vulnerable employment, so they're constantly fearful of losing their jobs. So we know already that people in this position will struggle to make the decision to self-isolate, even if they're required to do so. We've had an announcement this week from Matt Hancock about the introduction of a new payment for people self-isolating in areas of the highest risk areas, which, according to what we've heard today, potentially leaves us outside of the scope of this additional award or additional payment. But even if it was implemented, it's unlikely to address the needs of many citizens of Sheffield that are in poorly paid or insecure employment. And I just as an aside, in relation to that observation, Greg, that that the rate of the 13 quid a day was based on the national minimum wage. I mean, the rates of the national minimum wage for over 25s is £8.72 per hour. 13 quid is for a day, and that is based on the statutory sick pay rate. So we can see that it goes nowhere near addressing those concerns. What it does do, I think, is try to plug a gap between those self-employed or low-paid workers that don't hit the threshold for entitlement to SSP, which starts at 120 quid a week. So I think that's probably where the measure comes in. So just returning to my question. So my question is, what plans are there to ensure sufficient provision to anyone that finds themselves in the position, i.e. struggling to cope with this issue about financial consequences of self-isolation, to receive specialist advice and support about their employment situation, employment rights, and any benefit entitlement, and then secondly, to receive sufficient income to enable them to meet their essential outgoings, including any debt repayments, because those have been increasing, even for those workers that have been on furlough, and indeed in relation to meeting kind of household bills.
Can I go on, Julie?
Can I just start? Sorry, Sean, because you probably know as more than anyone with the work that you do, the hardship that people are facing. And in fact, not just because of COVID, they've been facing it for a long time throughout austerity, and COVID on top of it has made circumstances far worse. And we know all around the impact that austerity's had on certain individuals and families, and many of them in Sheffield. We do have something called the Emergency Assistance Grant that the government, in fact, have just signed off an acceptance, a grant acceptance to accept more money from government. But as usual, it definitely will not be enough to reach all the people that are in need. However, what this grant is meant to do is to do the very things that you've mentioned, help people struggling to afford food, you know, help people that have actually got no recourse to public funds. To be perfectly honest, we know there are those. We've also looking at people that are suffering from like fuel poverty and severe hardship. But we've also done separately to that introduced some policies around people in debt through council tax, through rent in particular. And we continue to pursue the government to extend, you know, the sort of rent evictions, let's say evictions, because people find themselves in. Unfortunately, that's only an extra 4 weeks. We know it's not long enough, but we need to push for that. So we do have a grant. We've just been awarded another £750,000. As I say, it's nowhere near enough, but we will be allocating it in accordance with our emergency assistance grant allocations. And I'm sure you'll be involved in disseminating that information and access to it on our behalf through contacts. Greg?
Nothing much to add, although I don't know the specific answer to the question, but I think we should commit to getting a proper answer to the question, because the social and economic harm from this it will be far more impactful than the actual harm from the virus itself. So I think it's beholden on all of us, not just the council but the city, to ensure that we collectively come up with the proper answer. But in terms of the direct answer to your quite difficult questions, Sean, I don't know the answer, but I will commit to getting you the answer.
I think just the observation in general terms is that compliance with employers ordinarily for us as an organisation with paying out SSP is troublesome at the best of times. During these times, arguably it's even worse, principally because only smaller employers that had fewer than 250 employees on 28th of February can claim the SSP rebate, but that's only for one time. And it's limited. It's a limited claim. So the difficulty for all of these workers, they're already struggling. You know, they've got to feed their homes, but also recognise their civic duty, and the balancing act is incredibly difficult.
Yeah, and just to add, the immense support that the voluntary community faith organisations and sector have played in Sheffield during this particular crisis and during this pandemic, and it is ongoing, as Greg said right at the start. We're not at the end of this. You know, to thank them, yourselves and representatives on the board, but everyone else in Sheffield that's stepped up to the mark. As I said, they've shown we've had such extraordinary action, support and kindness shown from many individuals, but also the social capital that we have in this city. I think we need to be extremely thankful for, and we need to find a way of securing that going forward. Right, I am afraid that draws the session to the end, because I do know people have got places to go and things to do. So I want to thank everyone who has participated in it, especially panel members, because everything we hear today we'll take forward to our next meeting to consider any comments or questions that have been raised and things that we need to further consider. I also want to thank everyone that's come in and raised questions, and apologise to those that have not had the chance to ask them. But to say there is the COVID-19 public questions at sheffield.gov.uk if you wish to submit them. We have noted all the ones that have been submitted today via Q&A function, but also just to say that there will be another event that we hopefully will be hosting for around 2 hours, the next one. But there is a scrutiny board on Thursday, the 3rd of September, and there is a full council on the 9th of September, where both are taking public questions. The scrutiny board is around the budget and the financial situation, which I think from some of the questions that have been submitted, I think may find that particular scrutiny board of interest, because some of the questions were relating to the finances of the council and the position, and why we're taking decisions that we've had to take, albeit some of them extremely difficult. And they may find that interesting to attend that. That's on 3rd of September, and you can register interest to submit public questions there, and then the council on the 9th of September. So thank you very much. Before I go, because I think we're going to try and do this every time, I just wish to remind everyone watching and everyone here of the advice and guidance that will help keep you and others safe. Wash your hands, keep your distance, Wear a face covering where required. If you have a symptom, get a test. Stay home and isolate. Give details of your contacts. Seek help and advice, especially medical if required. If a contact, stay home and isolate. Please keep yourself and everyone safe. Bye for now. Take care, and we'll see you at the next session. Thank you very much. Bye.
Bye. Bye. Bye. Thank you.
Bye-bye.